I wanted to talk about a interesting conversation that I had with the orientation coordinator
Mm-hmm.
um, the first week that I came into the MICU, and it was that day. It was me. It's another girl that is also an experienced nurse, or three. There was three of us that were experienced, and then there was one tech, and we were all coming to the MICU. And Nicole, her name's Nicole. She was just kind of going through like what to expect with the MICU, and she had a really transparent, very really necessary conversation about the amount of death that we're going to
Mm-hmm.
see on the unit. And I mean, I should have known that conversation was coming, but I was like so appreciative that she did have that conversation with us,
Mm-hmm.
and she was pretty much like, "This you're gonna see a lot of death,
Mm-hmm.
and you have to find a way to, well, you have to find somebody to talk to. It doesn't need to be a nurse,
Mm-hmm.
doesn't need to be your, significant other. It doesn't, but just somebody that you can, use or in your toolkit, to have some type of resiliency. And it was definitely an eye-opening conversation. And I wanted to ask you, like, do you feel like you've kind of acquired that skill set of resiliency, or do you feel like you still struggle with the amount of mortality that you see in the MICU?
Yeah, I'm glad Nicole was blunt about that.
Mm-hmm.
She's like, it's necessary. It's you can't really sugarcoat that.
Yeah.
As a new grad, I was not ready. I did not realize what type of unit I was stepping into. I thought it was a really cool unit. I thought I was going to learn a lot, jack of all trades, master of none, right? Like you see
Mm-hmm.
so much.
Yeah.
But it took some time. I had my first patient pass when I was on orientation, and that was a very hard day. And I was really lucky because, well, one of your friends from nursing school, Kelsey, was living with me at the time. And I remember
Yeah.
texting her that day saying, like, my patient died today. And I came home to and I will never forget this. I still have the note actually. She wrote a note, and she was working night shift that night, and she left me a note and a bracelet, and it was a compass bracelet. And she wrote me like such a kind note saying like, you know, it's okay. Like this is the first, but like you've been guided into this role for a reason. And I
Yeah.
like that. I don't know if Kelsey remembers this. Kelsey, if you're listening, I still think about that. Like I think you're placed in positions in your life where like you're supposed to be that person for someone. And like
Yeah.
it took a I won't lie to you, it took a solid 2 years. And I think that's because I was a new grad, and like you go through
Mm-hmm.
a lot in that transition phase as a new graduate nurse where you have to learn so much in such a short period of time and,
Mm-hmm.
balance that and being in the real world. But I I go back to that where there is so much death on that unit. And I think sometimes the death doesn't bother me. It's the prolongation of life where should we be doing this? And when we think about like
Mm.
futility of care and like, is this right? Should
Yeah.
we offer? You have all these things to offer. You have a big platter of things, right?
Mm-hmm.
We can keep people alive, but it always begs the question of should we? Is this
Yeah.
right? Um, is this right for this patient? And I
Yeah.
think learning that and I think I'm okay. I have become okay with death because it is it is better for the patients to be able to die with some sort of dignity than to be like pressing on their chest. And,
Mm-hmm.
you know, um, learning that and being okay with families coming to that realization, helping them come to that
Yeah.
realization. And I think about that compass. Like I'm supposed to be here to help talk to these family members and loved ones and know that like this is not just like my patient. This is not just a person with a breathing tube in,
Yeah.
lying in the bed. Like this is someone's mother, father, grandfather, brother, and trying to with a small piece of myself, put myself in their position to be able to help guide them to make a decision that is heart-wrenching for people, especially if
Mhm.
they've never had those conversations
Yeah.
with family members before. And then has made me be able to have these challenging conversations with my own parents and
Yeah.
talking about my grandparents and what is right for, or the not the right way to die, but how to be able to give somebody's death some dignity.
Yeah.
Um, and that is, I think, finding in within yourself to become okay with that. I have an easier time with that than I do when I'm like looking at this patient and the family's like, they're gonna be okay. Like we're gonna keep going. And I'm like, I have a harder time
Yeah.
dealing with that than
That's
a
such
patient
a
family
it's such
members.
an incredible skill to have
Mhm.
those incredibly difficult conversations